Hi everyone, so great to see you guys here today. My name is Olamide Shanuga. I am a dermatology research fellow and fourth year medical student at the University of California, Irvine. I'm also the founder of Healthy Curly Crowns Coalition, which is a program that brings together medical professionals, students, and community partners, all with the shared goal of trying to enhance and expand our understanding of coily, curly, textured hair. So I'm really happy to be speaking to you all today about understanding and empowerment when it comes to hair recovery after cancer treatment. I do, before I start, want to just set a disclosure that even though I'm in medical school and almost done, I am not a doctor just yet. I am a medical student and researcher. So this talk isn't medical advice, but it's really here to provide you with information and tools so that you feel more confident talking to your doctor about hair loss and what options might be best for you. Also, as a researcher, I definitely want to put acknowledgement to the fact that a lot of the things I'm going to be speaking about comes from academic literature, things that are published online in academic journals, and one of the largest limitations that I found is the lack of diversity in a lot of these studies, especially when it comes to speaking about African, Black, and Caribbean people. That's just a large problem that we have in research in general. There's just not a lot of people of color in these studies. It's hard to recruit, obviously due to some historical um, things that occurred when it came to research on people of color. So it's really going to take a lot of institutional effort and also effort from people in the community to allow us to have better data to help the needs of our community. With that said, I do want to just talk about briefly every point that we're going to speak on. Feel free to ask any questions that you have. But for this talk, we're going to be speaking about hair loss and regrowth after treatment. We're going to be speaking about cold caps and treatment options. We're going to be also talking about texture and pattern changes, scalp hair and protective strategies, and what survivors and caregivers should know. So before we speak about hair loss and things that we can do to prevent and treat it, I think it's really vital that we actually try to understand hair loss at a physiological level. So we're going to review the hair cycles. So with hair cycles, we have three phases. We have anagen, which is the growth phase. So this is when your hair is actively growing, the cells in your hair roots are dividing quickly, and it's really pushing the hair out, making it longer. So this phase is actually the longest and can last years, 2 to 8 years, as you can see noted down here. And it's when your hair is the healthiest and it's the fullest. The next phase is the catagen phase. And so this is a pretty short phase. It lasts only a few weeks. And during this time, hair growth slows down and the hair gets ready to stop growing. The base of your hair starts to shrink and separate from the blood supply. So think of this as the hair preparing to retire. And then lastly, we have the telogen phase, which is also known as the resting phase. So this is when your hair takes a break. For a long time, people thought that nothing happens during this stage, but we now know that it's more of a quiet recovery period. After resting, the hair can either stay in place for a while, or it can eventually fall out and making room for new hair to grow. So this is when your body decides whether it's time to grow new hair or to keep resting. And chemotherapy disrupts the cycle, specifically the anagen phase and the catagen phase, where your hair is growing or it's slowing down. And it really does this by targeting the hair follicles. So chemotherapy targets rapidly dividing cells, which are those cancer cells, but it can also impact other cells in our body. And hair follicles are created by cells. So when chemotherapy enters the blood supply and that feeds into your scalp, it's also going to be damaging those hair follicles as well and impact hair loss and regrowth. So in terms of expected timelines for regrowth post-chemotherapy, I was able to find a study that spoke about this, but the majority of the patients in this cohort were Japanese. And so they have different textures of hair, so the timelines might be different for us than it might be for people of other cultures. But what they found in the study is that about 3.3 months after completion of chemotherapy is when people started to see hair regrowth. And they actually saw the peak amount of regrowth being at 6 months. But there's definitely a few cases where some did not experience growth or had incomplete regrowth after 2 to 5 years. So it's really just kind of like a random thing about whether you're going to get regrowth or not. But there are some ways that we can actually see what factors are going to influence your ability to grow hair. The first thing being age. Patients who are younger have an easier time regrowing hair than patients who are older. Also, the treatment type. There are some treatments that make alopecia more severe, like anthracyclines or taxanes. So that's something you can speak to your physician about. If they have different options for you, you can have them consider which option would preserve the most amount of your hair. Uh, Nutrition and stress obviously also play a factor in hair regrowth, so making sure that your nutrition status is up to date, you're not deficient in any vital vitamins or irons that your body may need to grow hair. And then stress, of course, stress is such a large role in hair growth and just our overall health in general. I think we underestimate how much power stress really has in the wellness of our body. And then lastly, I also put down blood flow. By increasing blood flow to the hair follicles, we can allow them to grow better. And this can be from just gentle scalp massaging or derma rolling, something that's going to increase blood flow to really provide nutrients to your scalp is going to be really helpful for hair regrowth. So these are just some tips for overall scalp care. So as we've already said, your hair is in a very fragile, your hair follicles are in a very, very fragile state. So when it comes to scalp care, you really want to prioritize gentle, gentle, gentle. That should be the main word that is coming in your mind when you're thinking about scalp care. You want a very gentle cleansing routine that will protect your follicles. So nothing with perfume, nothing with color, nothing that's with sulfate. That comes for shampoos and conditioners. You really want to lay low on using any hair relaxers or hair dye, anything that could really cause more damage to the hair follicles, because your hair follicles are already undergoing some damage from the chemotherapy, so you don't want to add anything that you can avoid. You also want to avoid any kind of tension with the hairstyles that you do, so any kinds of extensions or anything that might be pulling at the front of the hair or in the middle of the hair, you really want to avoid those types of hairstyles as well. So any tight braids, you want to have hairstyles that are a lot looser. Moisturization is also very important, especially when we think about the curlier textured hair. Our hair, African American hair, is very prone to dryness, and so it can break really easily. And so we want to make sure that we're moisturizing our scalps either with some form of a leave-in conditioning spray. We can also use some lighter oils like castor oils or jojoba oils are very light, but you also want to be very cautious with the oils as well because they can be really irritating to the scalp and actually increase dandruff. So you want to find the product that really works well for you, but keeping your hair moisturized can be really important during this stage. And then I already spoke a little bit about protective styles. You definitely want to avoid trauma to fragile regrowing hair, and then gentle massaging and that can increase circulation, which is what I spoke about in the last slide. Cold caps, cold caps, cold caps. So this is something that I saw that many people were actually interested in learning more about. And there are many on the market. There's Penguin, there's Paxman, there's Polar. There's so many to choose from. But what exactly are these cold caps? And these cold caps actually work by constricting blood flow to hair follicles. So the coldness from this scalp is going to constrict the blood vessels, as you can see from my drawing in the below area. The blood vessels that are feeding into your hair follicle are going to constrict. So now chemotherapy isn't going to properly flow through those blood vessels, and it's not going to be really having any impact on the cells that are producing your hair follicles. And so this can be really helpful because if chemotherapy is impacting those hair follicles can be damaged. But you also want to be cautious about scalp checks for cancerous lesions in the scalp area, because if chemotherapy isn't reaching the scalp, then your scalp is not being protected from the cancer that's being treated. So you want to make sure that you're undergoing regular scalp checks with either a friend, a partner, your doctor, just to make sure that there isn't any new lesions that you should be concerned about. Who's eligible for these gold caps? It's really anyone with any hair type receiving chemotherapy, but there is caution for those who are taking certain kinds of chemotherapy drugs like anthracyclines, which is like doxorubicin or anything that ends in the word rubicin. The reports are showing that these cold caps are actually ineffective in these cases. So I'm sure what you guys can know is that, okay, cold caps can be used for everybody, but do they work for everybody? Do they work for people who have curlier textured hair? And so I actually really tried to dig into the literature to find this answer, and I found one study, which is I put in the top left corner. Does scalp cooling have the same efficacy in black patients receiving chemotherapy for breast cancer? And I was like, great, finally found a study. And in this study, they actually had 15 black patients with breast cancers, and they were taking different chemotherapy regimens. They were taking the anthracyclines, which I already said there's a bit of caution over, but they're also taking chemotherapy that did not include anthracyclines. And what they actually found is that they actually had to stop the study early, which is very surprising, and you don't really see that happen too often. But they had to stop the study early because of such poor results that they were getting. They were, after one cycle or two cycles, they were actually noticing that the 15 participants were experiencing some pretty severe alopecia or hair loss. So they had to stop it early because they weren't getting great results. They actually mentioned that only one person seemed to be getting any form of improvement from using this. So I found that very interesting. And so the type of cold cap that they use was called Paxman. And so I did my own little research, and by research I really went on TikTok just to get an idea of what kinds of cold caps black women are using, and I actually found a few black women who were using Paxman, and they were using it successfully. It seemed to be really helping them retain their hair growth. And so when I went back to the study, I think it's really important that when you're reading these kinds of academic studies, to look at the methods, because the methods can clue you in as to what went wrong. And the methods just tell you everything about how they actually did the study. What did they do? What was the step by step? If I wanted to recreate the study, I should be able to go back to the methods and understand what they did step by step. And I found the methods section to be very bare. It didn't really give me any details. It said that there were 15 patients and they had cold caps for their treatments. But what I was specifically interested in is, how did they take care of the hair during this time? What was their hairstyling? Did they just have an afro out and then they put the cold cap on top? Did they wet the hair at all? Did they moisturize the hair at all? Did they do anything to protect the hair? Or how exactly is the hair styled if using the cold caps? And I think for these studies, specifically about African American hair, it's very important to actually state the methods of how the hair was styled. And that was missing from this study. I'm not really sure if they had a hairstylist who was part of this team, or even people of African, Black, or Caribbean women or men who were part of this research team. So it's really hard to get an understanding about what their methods were. But I really say all this to say is to be really cautious about these academic research papers, because even though they had to shut the study down early, there's definitely proof from other people's testimonies about black women using cold caps and having success with it. So I think it's going to be really important that if you do choose to use the cold caps, to really take proper steps to make sure that you're putting yourself in the best position for these caps to work. So first, you want to really prioritize styles that give direct access to the scalp. The only way that these cold caps can work is that if they can reach the blood vessels that are feeding your scalp. And so we need direct access to our scalp. And our hair can be very coily and thick, so you really need to give our hair the space that it needs for these cold caps to reach our scalps. You want to make sure you're not having any extensions of any kind in your hair. You don't want to have any type of wigs on at all. You want to really try to have styles that you can either do the loose twists. I have locks in my hair, so I'm able to have a little bit more access to the scalp. You can also do cornrow styles, very loose cornrow styles that may be going down the crown of your hair so that they have access to the scalp as well. But access to the scalp is going to be the most important thing to make sure that these cold caps have the best chance of working on your hair. And so this is scalp treatment, but you also want to think about the strands that you already have. You want to make sure that you dampen your hair, because our hair is already prone to dryness, so we want to make sure we actually add a little bit more water than you may think is appropriate. And then you also want to consider using a leave-in conditioner or natural oils, because that ice interacting with your hair strands is just going to lead to breakage. So you want to make sure we want to protect our hair as much as possible before doing these cold cap sessions. And then lastly, you also want to make sure that these caps fit your hair snugly and that they work, and it's really contacting as much of your scalp as possible, because any part of your scalp that is not exposed to the cold cap is not going to be protected, and it's actually at high risk for hair loss. So if the cap is snug up here, but maybe around the front, there's no kind of snugness to it, or it doesn't even contact that area of the scalp, then that entire region is going to be prone to hair loss happening. So these are just some things that you can consider if you decide to do cold capping. It's definitely not for everybody. There's definitely some insurance barriers and price barriers involved in it too. So it really is a personal decision as to whether or not you want to use cold caps, but it can be a great way to protect your scalp during this time. So we talked a lot about prevention, preventing hair loss, trying to retain hair, but let's speak a little bit more about once your hair grows back and what to expect. And so one thing that you'll often hear or see is that hair texture starts to change. And so after chemotherapy, it is common for hair to grow back differently. It might be finer, it might be curlier, it might be straighter, or even grayer. And it really happens for various reasons. So first of all, the hair strand. Chemotherapy makes each hair strand smaller in diameter, so the new hair feels finer or softer than before. And then we also see that there's hair structure changes in the follicle itself. The cells that build your hair can be disrupted during treatment, which affects how the hair forms. And this can change how smooth or coarse your hair feels, or even how it curls. And then next, we also want to talk about graying. So we have another type of cells that are around your hair follicles, and these are called your melanocytes. And these are your pigment-producing cells. These are the cells that give your hair color. And these cells can also be affected by chemotherapy, which is why some people notice more gray hairs after chemo, even if they didn't have them before. And so that's just one thing to be cautious of. And then really just the base of it all, we want to think about our blueprint cells, our stem cells. So these are the cells that tell, they as they grow, they're kind of immature, and then they're like, I'm going to become a hair follicle. So these are the cells that transition into a hair follicle. And these can also sometimes get damaged during hair regrowth. And if these are affected, it might cause long-lasting or even permanent changes in the way your hair looks or even feels. More curls than before. Some people can actually say that they've noticed that. And so this happens because chemo can change the shape of your hair follicle, and which is where your hair grows from. This is the hair follicle. And this can influence your hair curl pattern. So these are just some things that once your hair does regrow because of the damage that your hair follicle and the cells around it that build your hair follicle and give color to your hair, because these cells are affected, it can really change the way that your hair regrows. And so there are no specific treatments that can universally manage or reverse changes in hair texture, such as, the hair becoming finer, curlier, straighter, grayer after chemotherapy. However, some interventions may help improve hair quality and promote hair regrowth. So if your hair is growing back unevenly, don't worry, this is something that happens, and there are some treatments that you can do. The first thing is minoxidil. Minoxidil can really help stimulate hair regrowth. Sometimes it's good to use minoxidil in combination with another kind of medication. So you want to think about anti-androgens like spironolactone, dutasteride, finasteride. One of those three combined with minoxidil can really give you some really great opportunity for hair regrowth. And then I've talked about this a few times. We really want to increase blood circulation back to the scalp. And so scalp stimulation of any kind, like massaging or derma rolling, if appropriate, could be also a very helpful method of hair regrowth. And then again, nutritional support. I think that's just like one thing that we can really try to identify in ourselves if we have any form of deficiencies. I think that can be a really helpful thing to do as well. And so eyebrows and lashes, so those are often the last to grow back. It can often take about 3 to 6 months after completion of chemotherapy for you to start seeing regrowth, and this is compared to the 3.3 months that we saw for the scalp. They all have the same cycle, but I think the time frame in each cycle is different in the eyebrows compared to the scalp, which is why we really see that difference occurring. But there are some cosmetic options that you can do. I know that some people may not want to not have any eyebrows or eyelashes, so you can consider microblading. You can consider brow pencils, false lashes while you're waiting for things to regrow back. But these cosmetic things can also impact the hair follicles, so you just want to make sure that you're kind of weighing in all of your options. And then of course there's also prescription options. You can use topical minoxidil specifically for the eyebrow section, and you can also think of bimatoprost, which is also called Latisse. You can use that to help regrow your eyelashes. as well. But you have to have a lot of patience when it comes to the eyebrows and eyelashes, because it is just going to take double the amount of time than it would for your scalp. And so lastly, I know I've talked about a lot about hair loss and hair growth, but I don't want us to undermine how important this topic can be. You know, for many Black women, it's not just hair. Hair is deeply tied to identity, pride, heritage. Hair loss can be extremely traumatic, not just physically, but emotionally, and it's okay to grieve and seek support. I know that you already have to deal with the diagnosis that you're dealing with, your cancer diagnosis, or whatever diagnosis that's leading to hair loss, but it's okay that you're also equally or even more sad and frustrated about the hair loss, about the change in your physical appearance, because I think it can really heighten the underlying diagnosis that you're suffering from as well. And so I just want to like bring some empathy to that, and just let you know that it's okay to seek support. This might be through therapy or support groups like you guys are all in, and talking to others in the community who get it. You know, talk to each other, find friends who may know what's going on. You know, just really avoid the pressure to bounce back appearance wise. Like, it's okay that you are adjusting to a new normal, or what could be a new normal. And so I just want you to know that is okay. And for any caregivers that are here and that are listening, I just want to also say that support does start with listening. We really need to offer affirmations, especially affirmations that are unrelated to appearance. Understanding that beauty isn't just what we see, but beauty is what we carry inside of us. So, really taking the time to really highlight that in the people that you care for and the people that you're supporting, you know, help survivors feel seen for their strength and for their inner beauty. And be open to learning how to care for textured hair. There's a lot of things that I spoke about how our hair should be styled or how it should be taken care of. And so if you're looking for, you know, practical ways to help, that can you can really work with your friends and who you're supporting to help them figure out hairstyles that might be good for cold caps, or it might be good for just everyday life. You know, help them get a shorter cut if that's what's appropriate for you guys. But, you know, be present at appointments, help us as a supporter if needed, and, you know, just do what you can to really help to validate the feelings that, you know, your people are going through. And so I just wanted to put a brief slide about that as well. And then lastly, there are so many resources and support groups that you guys may already know. You guys probably know more than I know, but I want to just highlight two organizations that I personally know, and just to make sure that these two are also in your repertoire as well. So the first one is the National Alopecia Areata Foundation. So alopecia is just a fancy way of saying hair loss. So this is just a foundation that is really centered around hair loss. They have conferences, they have support groups in different regions. They even have speakers who will come in. They'll have a lot of dermatologists and oncologists come in to just give their own think piece about what's going on, some up and coming treatments, some things you can do at home. And so getting connected to this organization could be really helpful. Last year, they actually had a national walk, and this was the first time they had a national walk that was in LA. So we're hoping to make this every year. I was part of the planning committee for last year's walk in LA, and it was just such an amazing event. We had about 200 people register. We raised nearly $20,000 for more support, for some more research on hair loss, and so it was an amazing event. So if you're interested in participating in the event or donating to the event, or, you know, being a volunteer, you should definitely follow the team on Instagram. It's called SoCal for Alopecia, and this is just for the LA walk if you're interested in that. But if you're interested in the organization as a whole, you can go to National Alopecia Areata Foundation.com or NAF.com to learn more information. And then this second resource is Maine MD. So this is one of my colleagues. She is a dermatology resident at UC Irvine. She's actually a Black dermatology resident, and she has the first physician-owned wig company, which is quite amazing, because I know that wigs can be really hard to find, or the right wig can be hard to find. I know you can go to a beauty supply store and buy a wig, but sometimes it's not exactly what you're looking for. Maybe it doesn't fit correctly, the texture of the hair is not what you're looking for, it just doesn't really feel like, it doesn't really portray who you feel inside. And so what I really like about Maine MD is that she comes to her company with a physician mindset. You know, she already knows that protection of your scalp is going to be the main priority. She can help you size your wigs, and the hair is amazing quality as well. So if you're interested, you can look at some of the products that she has on her website and on her Instagram. This is themainmd.com or at themainmd on Instagram, and you can set up a consultation or just review what products she has. And so I just want to make sure that you guys have those two resources. And with that said, that's actually everything that I have to talk about today. Thank you guys so much for listening. I hope that you guys gained something from this conversation. If you guys have any additional questions, feel free to reach out to me, and I will make sure that you guys have my contact as well. So thank you so much. I hope that you guys have a blessed rest of your day.